Many harbor misconceptions about radiation, bone loss, and brain swelling. Radiation is often imagined solely as a catastrophic force from nuclear events. The truth is, radiation exists in many forms around us. Some forms are natural, while others are man-made. Its effects can be subtle and accumulate over time. Understanding this ubiquity is the first step. Bone loss, similarly, is frequently misunderstood by the general public. It is commonly viewed as an inevitable consequence of old age. However, bone loss is a complex process. It can affect younger individuals, including men. Astronauts in space experience it rapidly. Certain medical treatments and lifestyle choices also play significant roles. Brain swelling, or cerebral edema, often conjures images of severe, dramatic head injuries. Yet, brain swelling can arise from a multitude of less apparent causes. These include infections, strokes, high altitudes, and even as a side effect of medical treatments. Recognizing its diverse origins is crucial. These three conditions, radiation exposure, bone density loss, and brain swelling, are more interconnected than many realize. They can influence one another, creating complex health challenges. Soldiers, cancer patients, astronauts, and even ordinary individuals can find their lives impacted by these hidden dangers. Understanding these connections is vital for both prevention and effective treatment in our modern world. Radiation, in its simplest definition, is energy traveling through space. This energy can take the form of waves or tiny particles. We encounter non-ionizing radiation daily, like radio waves and visible light, which are generally harmless. The concern arises with ionizing radiation. This type possesses enough energy to knock electrons out of atoms or molecules. This process, called ionization, can disrupt the delicate structures within our cells. X-rays and gamma rays are common examples of ionizing radiation. When ionizing radiation passes through the human body, it does not discriminate. It can damage any cell it encounters. The primary target within the cell is often its DNA, the blueprint for all cellular functions. Damage to DNA can have several outcomes. The cell might repair the damage successfully. It might die, a process called apoptosis, if the damage is too severe. Or it might survive with altered DNA, potentially leading to mutations. These mutations can, over time, contribute to the development of cancer. The body's response to radiation depends heavily on the dose and the duration of exposure. Chronic exposure to lower doses of radiation presents a different, more insidious threat. The subtlety of chronic exposure makes it a persistent public health concern requiring ongoing monitoring. The Chernobyl disaster in April 1986 serves as a stark, tragic lesson in the devastating power of uncontrolled radiation. A sudden power surge during a reactor systems test led to a series of explosions. These explosions released a massive cloud of radioactive materials into the atmosphere. This cloud spread over large parts of Europe, contaminating land, water, and air. The immediate aftermath was chaotic. Firefighters and plant workers were exposed to lethal doses of radiation, battling the blaze without full knowledge of the extreme danger they faced. Their heroism came at a terrible personal cost. The immediate health impacts on those closest to the reactor were severe. Over 100 first responders and plant personnel developed acute radiation syndrome, or ARS. Many succumbed to its effects within weeks or months. The nearby city of Pripyat was evacuated, its residents forced to leave their homes forever. The initial response was hampered by a lack of information and underestimation of the scale of the radioactive release. This event underscored the catastrophic potential of nuclear accidents. Despite its potential for harm, radiation plays a vital role in modern medicine. It is a powerful tool used for both diagnosing and treating diseases. Diagnostic imaging techniques like X-rays, kinetic scans, and mammograms rely on controlled doses of radiation. These methods allow doctors to see inside the human body without surgery. They can detect broken bones, tumors, and other abnormalities at early, often treatable stages. Radiotherapy or radiation therapy is a cornerstone of cancer treatment. It uses high-energy radiation to target and destroy cancerous cells. The goal is to damage the DNA of these malignant cells so severely that they can no longer divide and grow. This treatment can be delivered externally using a machine that directs radiation beams at the tumor, or it can be delivered internally through brachytherapy, where radioactive sources are placed directly into or near the tumor. For many cancers, radiotherapy offers a chance for cure or significant palliation of symptoms, improving quality of life. The principle behind effective radiotherapy is precise targeting. Medical physicists and oncologists work meticulously to plan treatments. They aim to deliver the maximum possible dose of radiation to the tumor. Simultaneously, they strive to minimize exposure to surrounding healthy tissues. Section 5. Weightless bones. The perils of microgravity. Our bones are not static, inert structures. They are dynamic, living tissues constantly undergoing a process called remodeling. This involves two main types of cells, osteoblasts, which build new bone, and osteoclasts, which break down old bone. On Earth, the force of gravity constantly pulls on our skeletons. This mechanical loading signals the osteoblast to keep building, maintaining bone strength and density. Without this constant stimulus, the balance shifts. In the microgravity environment of space, astronauts experience a significant reduction in this mechanical loading. Their bones no longer need to work as hard to support their bodies or resist gravitational pull. As a result, the activity of osteoclasts, the bone-resorbing cells, begins to outpace that of osteoblasts. This leads to a rapid loss of bone mineral density, particularly in weight-bearing bones like the pelvis, femurs, and spine. Astronauts can lose bone mass at a rate of about 1 to 2% per month. This is far faster than typical age-related bone loss on Earth. Section 6. The pressured brain, understanding cerebral edema. Brain swelling, medically termed cerebral edema, is a serious condition. It involves the accumulation of excess fluid within the brain tissue. The human skull is a rigid, unyielding container. This means there is very little room for the brain to expand. When swelling occurs, it increases intracranial pressure, or ICP. This elevated pressure can compress delicate brain structures. It can also restrict blood flow, depriving brain cells of essential oxygen and nutrients. If not managed promptly and effectively, cerebral edema can lead to severe neurological damage or even death. Numerous factors can trigger brain swelling. Traumatic brain injuries, such as those from a severe blow to the head, are a common cause. Strokes, both ischemic, caused by a blockage, and hemorrhagic, caused by bleeding, can lead to localized or widespread edema. Brain tumors can cause swelling by disrupting normal tissue and blood vessels. Infections like meningitis or encephalitis can also induce an inflammatory response that results in cerebral edema. Section 7. Homeostasis lost, the body out of balance. Homeostasis is a fundamental concept in biology. It refers to the body's remarkable ability to maintain a stable, constant internal environment. This delicate balance is essential for survival. Our bodies continuously adjust to internal and external changes. Temperature, blood sugar levels, pH, fluid balance, and countless other parameters are tightly regulated. This regulation occurs through complex feedback mechanisms involving various organs and systems. When homeostasis is maintained, our cells, tissues, and organs can function optimally. Disruptions to this equilibrium, however, can lead to dysfunction and disease. Radiation directly assaults the body's homeostatic mechanisms at a cellular level. Ionizing radiation damages DNA, proteins, and lipids, disrupting normal cellular processes. This can trigger stress responses, inflammation, and even programmed cell death. If the damage is widespread or repair mechanisms are overwhelmed, tissue and organ function can be compromised. For instance, radiation damage to the bone marrow disrupts the production of blood cells. This affects oxygen transport, immune function, and blood clotting, all critical for overall homeostasis. Bone loss, whether due to microgravity, aging, or disease, represents a clear disruption in skeletal homeostasis. The normal balance between bone formation by osteoblasts and bone resorption by osteoclasts is disturbed. Section 8. A triad of trouble connecting radiation, bones, and brain. The health issues of radiation exposure, bone deterioration, and brain swelling are not merely parallel concerns. They are often deeply interconnected, forming a complex triad of physiological disruption. Radiation, for example, can have profound effects on bone marrow. The bone marrow is the factory for blood cells, including immune cells. High doses of radiation can suppress or destroy marrow function. This not only weakens the immune system, making the body vulnerable to infections that could affect the brain, but also impacts the cells involved in bone turnover, potentially exacerbating bone loss. Systemic inflammation is another critical link. Significant radiation exposure, such as that experienced during cancer radiotherapy, can trigger a widespread inflammatory response throughout the body. Chronic inflammation is a known contributor to increased bone resorption, accelerating bone loss. Furthermore, systemic inflammation can affect the integrity of the blood-brain barrier. A compromised barrier can make the brain more susceptible to swelling, especially if other insults like minor trauma or vascular issues are present. Section 9. Guarding our health vigilance in a modern world. Navigating the health challenges posed by radiation, bone loss, and brain swelling requires proactive vigilance. Regular health checkups serve as a cornerstone of this vigilance. For individuals with known risk factors, such as occupational radiation exposure or a family history of osteoporosis, tailored screening is essential. Early detection of bone density changes can allow for timely interventions. Similarly, monitoring for neurological symptoms is crucial for those undergoing brain radiotherapy or those at risk for conditions causing brain swelling. Open communication with healthcare providers about any new or concerning symptoms is paramount. Risk management strategies are vital, particularly in environments with known hazards. For workers in industries involving radiation, strict adherence to safety protocols is non-negotiable. This includes using appropriate shielding, minimizing exposure time, and maximizing distance from radiation sources. Dosimetry badges help monitor accumulated exposure. For cancer patients undergoing radiotherapy, medical teams meticulously plan treatments to target tumors precisely while sparing healthy tissue. Understanding and mitigating these risks is a shared responsibility between individuals and the institutions that oversee these activities. Protecting ourselves requires awareness and action. Preventive measures can significantly bolster our body's resilience. Maintaining good nutrition is fundamental. Adequate intake of calcium and vitamin D is crucial for bone health throughout life. Regular weight-bearing exercise, such as walking, jogging, or strength training, stimulates bone formation and helps maintain density. This is particularly important for preventing age-related bone loss and for astronauts trying to counteract microgravity effects. A balanced diet rich in antioxidants may also offer some protection against cellular damage from various stressors, including low-level radiation.